Mental illnesses are a growing public health concern affecting individuals and families worldwide. Singapore is no exception. According to a mental health survey in 2010, 1 in 16 people in Singapore will suffer from depression in their lifetime. But it's not just confined to adults. Children and teenagers have their own mental health issues to contend with as well. The top 3 conditions seen at outpatient clinics are attention deficit hyperactivity disorder, stress-related problems, and autistic spectrum disorders. So to cater to younger patients, the Institute of Mental Health set up a hotline for schools 6 years ago under its REACH program, which focuses on response and early intervention. So to tell us more about it, joining us in studio is Dr. Ong Se Hao, a senior consultant at the Institute of Mental Health, and Joycelyn Neo, a senior occupational therapist from the REACH program. So guys, thank you very much for coming today.
Thanks for having us.
So Dr. Ong, we'll start with you. When the hotline was set up in 2007, you had about 300 calls, but fast forward to 2011, you had over 8,000 calls. What proportion of that were legitimate mental health cases?
Well, the purpose of this course is to let school counselors be confident about what cases they're handling and to get the necessary professional advice. Out of that number of calls, in probably 10 to 20% probably warrant closer examination. So the REACH team would go down to the schools or the children's homes if necessary to make their assessment, and then later on follow up with a case conference with the school personnel. And only if indicated, for example, if the kids needs to be medicated or need some intensive therapies, they will then be referred to the clinics.
Okay, so Joycelyn, I'll throw out some numbers for you as well. Within that 4-year period, the number of pupils referred from schools went up from 14 to more than 700. So you deal with a lot of students under the REACH program.
Right.
What are the most common mental illnesses that you have to deal with?
Okay, I think the most common ones are the behavioral type problems like attention deficit hyperactivity disorder, and then increasingly in the teenagers we are seeing more and more coming to us with mood related problems like depression and anxiety.
Okay, so there are overlaps between mental illnesses that children deal with and adults as well. What would those specifically be apart from depression?
Well, most of the time, I mean, the children, as they come of age to become teenagers, they have a unique set of problems like academic problems and relationship problems, friendship problems, even boy-girl with relationship problems as well. And very often these are the same kind of triggers for adults as well, where adults will have work-related problems, issues, stress, as well as interpersonal relationship problems as well. So even though they are quite different, but they are also similar in the sense of their way it came about, the mental health disorders.
Very emotional issues that they have to deal with. So REACH, the program is all about early intervention. What would you say are the consequences of late treatment?
I think a possible consequence of late treatment could be that if undetected, the symptoms may actually persist or even deteriorate. So for example, a depressed teenager, if he or she is not picked up by schools or not picked up by the REACH teams, for example, he or she may actually go on to have even more difficult difficult life in that sense, because he does not have the coping mechanism to actually deal and manage with the
So we talked about safe clubbing earlier in our other interview. Are you seeing an incidence of more teenagers suffering from alcohol abuse problems or alcohol addiction problems as well in Singapore?
Well, there have been recent reports about binge drinking in the young people today because alcohol is, I guess, most accessible, right? And sometimes teenagers also may deceive the age to assess alcohol. It is a real problem, and we henceforth work very closely with our hospital's National Addictions Management Service to actually identify and manage these teenagers with drinking problems. And majority of these teenagers who drink or have drinking problems are also in schools, and the school counselors are also then able to help us identify them, and we work closely at a multidisciplinary team to help these kids.
So it's a multi-pronged approach to solve the problem.
Exactly.
All right, thank you very much. It was great speaking to you guys. Thank you for coming in today.
You're welcome.